Funny that we have to come to California and to see each other. Thank you for the introduction. Let me just get set up here. And thank you to all the sponsors today for inviting the Office of National Drug Control Policy to come speak with you today. I am sorry that Director Michael Botticelli was not able to come, and also that my colleague Jim Civilli was not able to come. We're kind of busy these days, so that's a good thing, but I'm very happy to step in. One of the things that Director Botticelli says is that we all have an important role to play in addressing substance use and its consequences. And today I'd like to talk about the Obama administration's activities to reform our nation's response to substance use and the role of ONDCP to move these efforts forward. ONDCP is a component of the Executive Office of the President and was created by the Anti-Drug Abuse Act of 1988 to advise the U.S. President on drug control issues. By statute, we annually engage in 3 primary efforts to guide U.S. drug policy. We developed the National Drug Control Strategy, which has specific action items to reduce illicit drug use, the availability of drugs, and the consequences of drug use. We also develop and coordinate a consolidated drug control agency budget to implement the strategy, and we coordinate and oversee implementation of the drug control policies and objectives, including the priorities that are set forth through the budgets and the strategy. These 3 activities guide our administration's efforts to not only reduce drug use, but also reduce manufacturing and trafficking, drug-related crime and violence, and drug-related health consequences. One of the marks of ONDCP under the Obama administration is our commitment to restoring balance to our U.S. drug control efforts by coordinating an unprecedented government-wide public health and public safety approach to reducing drug use and its consequences. So the National Drug Control Strategy, as I said, is the government's primary blueprint for drug policy. The strategy is a science-based plan that sets forth the overarching goals and objectives through which to reform, rebalance, and renew our U.S. drug policy. The goals and objectives are to prevent drug use, expand access to treatment, reform our criminal justice system, and support Americans in recovery. We also have 3 signature issues: the prescription drug abuse plan, prevention, and drug driving. Specifically, the strategy is guided by 3 concepts. Addiction is a brain disease that can be prevented and treated. People with substance use disorders can recover, and innovative new criminal justice reforms can help stop the revolving door of drug use, crime, incarceration, and rearrests. Throughout much of the past century, scientists studying drug use labored in the shadows of powerful myths and misconceptions about the nature of addiction. When science began to study addictive behavior in the 30s, people with substance use disorders were thought to be morally flawed and lacking in willpower. As you know, those views shaped society's responses to substance use disorders, treating their condition as a moral failing rather than a health problem. In turn, this led to an emphasis on punitive rather than preventive and therapeutic responses. You're a pretty sophisticated audience, so you may wonder why I raise this with you. You may say, today's responses to substance use have begun to change, and in fact, there are groundbreaking discoveries about the brain that have revolutionized our understanding of drug addiction. We can respond more effectively to the problem. And so yes, there has been change. We are now in the midst of a shift in public thinking, and we have incredible momentum on the national stage. But still, people think these things. The misperceptions and misconceptions exist. And it is important to keep it at the forefront of our practice and our thinking when we talk with patients, families, and especially our health system partners, so that we can foster supportive environments in which people can get better. The negative influence of language on perceptions can also hold true among trained professionals, and I am one of them, so I can say that. One study asked substance use disorder treatment and mental health clinicians to respond to client vignettes that were identical except for the fact that one